Welcome back to the Aslan Health Podcast. I'm Dr. Mike, and today we're beginning a three-part series on prostate health. This is prompted by the news that I recently received. Another longtime friend of mine and dear brother in Christ was diagnosed and treated for this condition. This episode, which is titled Reveal What Most Men Don't Know, Can Hurt Them. The topic of prostate health is rarely openly discussed and quite often misunderstood. Even though this podcast is not intended to diagnose or treat undiagnosed prostate conditions, it is my desire to pull back the curtain of misinformation on this quiet epidemic, and will reveal some science to silence the stigma, along with actionable insights, and provide practical protocols for palliating prostate pathology. No pressure. Let's do this.
Welcome to the Aslan Health Podcast, where science meets soul. Your host for this program is Dr. Mike Hauman, an experienced physician, a certified functional medicine provider, a certified insight coach practitioner, and a devoted follower of Jesus Christ. If you're tired of feeling stressed out, exhausted, overwhelmed, or stuck in survival mode, you're in the right place. So take a deep breath. Let's be transformed by the renewing of our minds. Here's Dr. Mike.
As we begin today, let me assure you that this series will not be a detailed lesson on anatomy and physiology or a delineation of standard pharmaceutical and surgical interventional approaches. Those are detailed elsewhere. I intend, instead, to reveal this issue in a G-rated manner to gain understanding, and then reset the applicable mind, body, and lifestyle factors, and finally provide a number of practical, functional items to support your renewal. Stay with me so that you or someone you know and love can have help and hope on their journey with this issue. Now, the prostate is certainly not a glamorous organ. It's unseen, unheard, and often ignored. Here's a story to demonstrate exactly what I mean. Now, I have been an active participant in various weekly men's meetings and fellowship groups for over 40 years now. Reflecting on the substance of those countless conversations with men, I only recall the prostate being mentioned one time by one guy. This friend had experienced his first manual prostate check during an annual physical exam, and he was seeking support and the collective experience of the other members of the group. He offered his experience with this, and in exchange, he received silence. Now, the gland itself may also be silent, yet it's a vital part of the male anatomy. It's located just below the bladder, where it surrounds the urethra, which is the medical name for the tube that delivers urine out of your body. Now, the gland itself has several functions, including making the fluid in semen and playing a role in reproductive health. However, for the purposes of our time together today, let's talk about what happens when the prostate gland goes awry, when it grows or gets inflamed or becomes malignant. When that happens, it can alter almost everything from sleep to physical intimacy, impacting overall health and well-being. So, let's reveal some of those details. Now, prostate problems are extremely common. By the time a man reaches middle age, his prostate has often already begun to enlarge. In fact, by the age of 60, about 50% of men will have some degree of benign prostatic hyperplasia, or BPH. Now, that's the medical term for an enlarged prostate. And by the age of 85, well, that number is nearly 90%. In simple, non-medical terms, that means half of men have an enlarged prostate by the age of 60, and nearly all men are affected by the age of 80. While BPH itself is non-cancerous, it can create significant symptoms that overlap with prostate cancer. Unfortunately, prostate cancer itself is very common, having the ignominious distinction of being the second most common cancer affecting men. It's ranked number 2 only after skin cancer. Prostate cancer is also responsible for 35% of all malignancies in men, and it's the second leading cause of cancer death in men, only behind lung cancer. So let that settle in for a moment. This isn't a rare condition. It's not something out of the ordinary. It's relevant for nearly every man with an ever-increasing risk as he ages. So, what's the hidden cost of ignoring the prostate? Well, the symptoms of prostate dysfunction often come on slowly and quietly. Men and doctors are often guilty of dismissing the symptoms as just a part of getting older. But ignoring the signs of trouble isn't wise. The common urinary tract symptoms of prostate issues include the following: frequent urination, especially getting up multiple times at night, call that frequency. An urgent need to urinate, often out of the blue, call that urgency. Then trouble starting the urine stream or a weak stream, call that hesitancy. There's dribbling at the end of urination, and finally, the feeling that the bladder itself is never completely empty. Now, these symptoms largely overlap between BPH and early prostate cancer. So use the symptoms as a warning sign of prostate issues, not as a diagnosis. These symptoms occur in part because the prostate enlarges and it presses on the urethra. Let me provide a helpful analogy. So imagine that your urethra is like a garden hose. This hose is the one that carries urine from your bladder to the outside, just like your garden hose carries water from your house to the outside. Now, imagine that you place your garden hose through the Y, or the crotch, of a young sapling tree. The sapling's trunk is immature, soft, and it doesn't press on the hose at all. It's just holding it. However, as time passes year after year, the tree continues to grow. Its trunk thickens and expands, and it presses on the hose. Little by little, it compresses and squeezes that hose. Not with a sudden crush, but with a gradual, persistent pressure. Now, the water still flows through the hose, but it takes a little more effort to get it started. And over time, the pressure on the hose increases, and the water begins to trickle instead of flow. Sometimes the garden hose even backs up, causing the nozzle to drip even after you've turned it off. As time passes and the tree grows, the water stream encounters increasing pressure and resistance to normal flow. That's what happens as the prostate enlarges with age, because the urethra runs right through the center of the prostate gland. Additionally, over time, as the bladder, which is a muscle, it works harder, it changes, and like most muscles, it can lose strength with advancing age. This too can make it more difficult to push urine efficiently. These factors together generate the symptoms that we mentioned earlier: frequency, urgency, hesitancy, dribbling, and incomplete voiding or emptying. Because these changes happen gradually, men often tell themselves, I guess it's just part of getting old. I'm sure there's nothing I can do about it. But here's the necessary truth. Normalizing dysfunction can delay the very help that you need. And that delay can have real and unnecessary consequences for your overall health. Left unchecked, severe BPH can lead to bladder damage, recurrent urinary tract infections, kidney strain, bladder stones, or even urinary retention that requires emergency care. Prostate cancer, too, can start silently. Caught early, it's highly treatable. If left unattended, it can metastasize and spread to bones or other organs, posing a serious threat to your overall health and well-being. Aside from these life-threatening issues, consider the daily disruptions and the frustration of interrupted sleep each night, the embarrassment or anxiety in intimate moments, the feeling that your body is betraying you. These aren't trivial. They impact your comfort, your work, your mood, marriage, mindset, fear, and your overall sense of well-being. So where does God fit in? Well, let me offer faith and a functional perspective. Proverbs 9:9 provides this encouragement. Give instruction to a wise man, and he will be wiser still. Teach a righteous man, and he will increase in learning. That is exactly what I'm attempting to do with the Aslan Health podcast, to increase your knowledge, understanding, and wisdom. We are called to steward our bodies wisely, and that includes tending to even the small, often hidden parts of ourself. Functional medicine reminds us that our body systems are all interconnected. The prostate doesn't act alone. It's influenced by hormones, inflammation, diet, environmental toxins, stress, and your overall metabolism. When something in one area goes off track, it can create a ripple effect through your entire system. It is not wise to ignore what's hidden, even inside our own bodies. God is not afraid of the details. He formed our inward parts, as David reminds us in Psalm 139:13, knowing every nook and cranny, every detail, every cell. He invites us to care for them, to bring light into dark places, and to seek healing when something is not right. I mentioned Proverbs 9, and it continues in verse 11, saying, Your days will be multiplied, and years will be added to your life, if you are wise. If you are wise for yourself, if you scoff, you alone will bear it. My friend, I plead with you, be wise and add years to your life. So let's reveal what's really going on and what it means. At the heart of today's message is this truth. Prostate problems aren't just about inconvenience, they're warning lights. They're invitations to pay attention. Think of them as signals from your body saying, hey, something needs looking at here. Now, we'll dive deeper into the why and how in the next 2 episodes. But today, I want to challenge you. Stop pretending everything is fine if it isn't. If you're getting up several times a night to use the bathroom, if you notice other symptoms like urgency or hesitancy, dribbling, or incomplete bladder emptying, don't ignore them. If you have identified these urinary changes, don't shrug it off and convince yourself that it's just because you're getting older. And if you've never had a conversation about your prostate with your doctor, well, then stop and consider doing so. This is not intended to generate fear. I'm not attempting to scare you in any way. This is about wisdom and encouraging you to pursue help for a common and almost universal problem for men. It's about honoring what God has created in you while identifying the common potential pitfalls and treating your health like it matters, because it truly does. When God tells us in Romans 12:1 to present our bodies as a living sacrifice, it means caring for them, not ignoring the warning signals and hoping against all common sense that our issues will go away. Well, with that being said, what can you do about this today? Here is your reveal assignment for the week. Practical, simple, concrete steps to bring this prostate issue into the light. Number 1, take inventory. Are you experiencing any urinary symptoms? Nighttime trips, urgency, frequency, hesitancy, weak stream, dribbling, etc. Acknowledging your symptoms, don't brush them aside. Write them down and track them. Now, I've created a basic symptom tracker PDF and included it with this episode's show notes. It's free. Download it and use it. Number 2, schedule an appointment if you're having an issue. Don't put it off. Schedule an appointment with a trusted healthcare professional. If you don't know where to begin, an exam with your primary care provider or a urologist would be a great place to start. If you're over the age of 50 or these symptoms seem to apply to you, please have an informed discussion about your prostate health with a professional and pursue appropriate management options. More on that next time. 3. Talk with someone you trust. Bring your concerns into the light. Confide in a friend or your spouse to inform them that you're paying attention to these symptoms and ask for prayer and accountability. Most men find it easier to ask for help when they have clear support and they're not going it alone. And of course, talk openly with your healthcare provider when you have the opportunity. If you're unsure how to do that, then be prepared and listen to the Aslan Health podcast series on making the most of your healthcare visits. Download the associated free helpful resource guide connected to those shows. Now, as a final encouragement today, if this applies to you or someone you know, don't wait. I'm reminded of the encouragement found in the book of Ephesians, chapter 5, where the Apostle Paul explains the importance and significant interplay of the husband-wife relationship as an example of Christ and his love for the church. In the midst of that discourse, he states in verse 29, "No one ever hated his own flesh, but nourishes and cherishes it, just as Christ does the church." Now, my friend, do you care for your body well as Christ cares for his church? Take inventory, share your issues with someone you trust, and get help if you need it. Remember, what remains hidden remains vulnerable, but what's revealed can be addressed. With wisdom, courage, and God's help, there is hope. Well, thank you for joining me today as we revealed some details about prostate health. Next time, in the Reset episode, we'll discuss helpful mindset shifts, appropriate supplements, integrative care options, exercises, and how to partner with your provider with courage and clarity for improved prostate health. Until then, my friend, be well, be wise, and live whole. This is Dr. Mike Hauman with the Aslan Health Podcast. Please like, subscribe, and follow to catch every episode. Then, share with others who may benefit from this program. Many blessings to you. Until next time, my friend.